Well, hello there, Sonoma County, Napa County, and Aloha Maui. This is Dr. Tom on Ask the Expert
Karina,
with
hi.
with Karina. Right, Karina doesn't have a last name. She's like the last time we said that she's like Madonna or Prince. Hey, Karina, how are you?
I'm doing well, thank you. How about
Great. Sorry,
yourself?
yeah, we're sorry we're a little late getting on there. We had a little technical difficulty getting on the air, but we are here now, and it's exciting to be back
Yes,
on the air with you, Karina. Thank you
yes,
for
thank
being here.
you.
So, Karina, today what we're going to try to do, and we're going to try to do little vignettes. We're going to do little five
hmm
minute topics, okay, today.
Okay.
So this is sort of like we're in the lightning round here
All
on
right.
Ask the Expert.
Okay.
So let's start off. Let's start talking about SmartLipo body
Yes.
sculpting.
Yes.
Okay, so you're our surgical liaison, and people are calling in all the time. What seems to be the number one area that people are concerned about when they are interested in body contouring?
Yes. Usually it's their stomach, the gut area.
The gut. You're so eloquent. The
The
gut
gut.
area. Okay, so the gut area,
Yes.
and so that means the front of the
The
belly,
front of the
or
belly.
front of the tummy. Okay,
Yes.
the abdomen, and any other areas that they're
Um,
concerned about.
Not yes, there are other areas under the chin, there's excess there, maybe sometimes a little bit on the back or the muffin top area that people are seeing, and when they're trying to fit into their pants or their dresses or those kind of things.
Those kind of things. So the muffin top area. So you're right. The number one area, of course, people are contacting us for body
hmm
contouring, and they're looking at the abdomen. So we talked to them a little bit about Smart Lipo,
Right.
and for those who maybe have just tuning into us on Ask the Expert here, we're here every Thursday from 12:30 usually to 1 p.m. And we've chatted a lot about Smart Lipo. I was actually the first surgeon to introduce Smart Lipo or laser liposuction to Northern California way back in 2007. Were you
hmm
born then yet?
I was. I
You,
was in sixth grade.
oh God, you're killing me. Okay, you were in sixth grade. So, Karina, we introduced it, and so of course we have a large experience with this, and people are calling. What is usually the reason that they're calling our office when they're interested in smart lipo or laser or body
Right.
contouring?
Primarily it can be people who are working out, they're eating healthy. They feel like there's just that one area that they say, I just can't get rid of it. I do crunches, I do all these crazy things to try to get rid of it. And I feel like there's still some fat in my stomach area.
Right. So definitely that area around the belly button. A lot of times, I love kids and how they name things. The donut, right? The donut right around the belly button. That's an area that's really tough to get rid of, no matter how much we work out. And even doctors and nurses and medical people, we tell everyone you cannot spot work off
Right.
something. Oh, I'm going to do crunches, so my belly's going to get smaller. Well, it doesn't work that way, right? I mean,
No.
do your crunches because it's healthy for you. You want to
Right.
get stronger, but it's not going to spot reduce that
Right.
area. So that's where smart lipo or laser liposuction is perfect for that
hmm
area.
hmm
So patients come in a lot of times and they're concerned about their abdomen. And we have them usually get disrobed,
Right.
and we take photos. We have them look. We have a three-way mirror, and they take a look at themselves. There's usually another area when we look at the front of the abdomen that we
hmm
talk about, and I spend a fair amount of time with the patients. What
Right.
area is that?
Muffin top.
The muffin top, exactly. So that's kind of, we call it the flanks, right?
Flanks, right.
And so if you put your hands on your hips, kind of right above where
hmm
your hands are on your hips, in that area, the waist area and the back area is an area
Right.
that actually it's really an aesthetic or a cosmetic unit
hmm
with the front of the abdomen,
hmm
or the belly or the
Right.
gut, as you call it. Okay. And so a lot of times it's not that we're trying to upsell someone in terms of saying, oh, if you're going to do the front of your abdomen, you should do your waist and
Right.
your side. But it's very rare that somebody has just an isolated area on the front of the
hmm
abdomen. If you are one of those people, we love you because we can go in there, we can do our smart lipo, laser liposuction in that area and get great results, and
hmm
that's wonderful. But probably 95% of the population, when they come in and they're concerned about their abdomen, um, they may not see it, but really that area is confluent with usually weight gain or volume of fat in the waist area
Right.
behind the back area. And I know that for me, who has been relatively slender all my life, just kind of when the pandemic hit and we weren't able to get to the gym and all, now I look like a Vietnamese pot-belly pig with my skinny little arm and legs and my little pot belly. So I'm definitely a candidate for smart lipo. But doing the waist and the flank area, it can really accentuate in a positive way
Right.
your body image, the aesthetics of it. Um, so what do you, when the patients call you about body contouring,
Mhm.
what do you tell them are the advantages of doing it the way that we do at our Dr. Tom Cosmetic Surgery?
Right. So because it's done awake, our procedures, we don't put people to sleep. The patient can feel a little bit more clear after surgery, less nausea and vomiting that can happen after surgery for the patient, and not necessarily a quicker recovery because it's still a surgery, but
Mhm.
it can be a lot easier on the patient.
Right. So actually, I agree with you. So we do everything under local tumescent anesthesia. So that's where we inject local anesthesia into the area of concern,
Mhm.
and that's where we work. It takes a little bit longer because we
Right.
have to take our time injecting the local. We're actually more gentle with the tissues, and I think that's a positive for
Right.
the patient's recovery. And it's amazing how we can do a tremendous amount of body sculpting
Mhm.
all under local anesthesia, and the patients love it, especially for someone like me, because I absolutely get sick with general
Right.
anesthesia. We call it post-op nausea and vomiting,
Mhm.
or PONV, post-op nausea and
Mhm.
vomiting. And I absolutely get that. I can't handle narcotics, pain
Right.
medication, and so forth. So having procedures done under local is a key
Mhm.
for me. The other is a lot of times we're taking care of young moms,
Right.
right? And they're feeling a little guilty, right?
Mhm.
Why are they feeling guilty when they come in?
Yeah, it's a big procedure to have, right? And there's risks that can go into it.
The
So
risk, and
yeah,
so they're concerned that they're mommies, and they're saying, hey, you know what, I have kids and I want
right.
to minimize my risk. So they know that we do everything under local
Mhm.
anesthesia, and I have to tell you that we've done over 3,000 cosmetic procedures all under local anesthesia, and our track record is amazing. No hospitalizations, uh,
Right.
just a wonderful track record. And I am going to kind of go against what you said in terms of the recovery, and that you said, it's still a big operation. Maybe the recovery is not as quick. I absolutely
Right.
think that the recovery is quicker. You have less pain
Mhm.
afterwards because of the local anesthesia. And because of the local anesthesia, we have to stay within the area that we
Right.
injected. So there's less risk of hitting other parts of
Areas.
the
Mhm.
areas that we don't want to be treating, and it does lead to a very quick recovery,
Right.
much quicker. I'm going to say that about half the patients who have laser lipo or
Mhm.
smart lipo, the abdomen and flanks, that about half the patients can just take Tylenol or
Mhm.
ibuprofen afterwards, and they do fine. The other half might need an oral medication like a Norco,
Right.
Vicodin, hydrocodone, or oxycodone for pain. But
Recovery.
so I do
Mhm.
think that recovery is quicker doing smart lipo. Um, in terms of the post-op recovery for these patients to maximize their best results,
Right.
what are your recommendations for that?
Um, Definitely allowing yourself to recover and rest at home.
Right.
And then we do ask for we give you all the information, but there
Mhm.
is a surgical garment
Right.
or a compression garment that we want you wearing for at least 6 weeks for the recovery time to help with those results.
Absolutely. The compression garment is
Hmm.
huge. Okay, I'll just give you another example. Let's say you have a hip replacement.
Hmm.
You have a hip replacement. What is almost as important as the expertise of the surgeon who took care of you and your surgical team anesthesiologist? It's your post-op physical therapy.
Right.
And so with laser lipo or any kind of lipo or body contouring, the garment is key. So
Absolutely. Hmm.
what do we usually tell them to do? The first 2 weeks, are they supposed to wear 24/7, or
Right.
what do they
So
do?
the first 2 weeks are mandatory. We want you to wear it morning and night during that period.
Mhm.
And then after that, it is optional during the day, but highly recommended for a total of 6 weeks. So additional 4 weeks.
Right.
Mhm.
Okay. So a total of 6 weeks. And I absolutely personally have seen that make a difference. It sort of shrink wraps you. So be dedicated to get the best results. Follow the
Mhm.
post-op directions that you're educating them all the time on. And I really appreciate that.